February is Heart Month, and for women, menopause can play a bigger role in your heart health than you might think. Dr. Heidi Werner is a family medicine physician with Amplify Health. She's also certified in menopause care. She joins us now for this conversation. Good morning. Great to see you.
Good morning. Nice to see you as well.
Yeah, so kind of a surprising connection. Tell us a little bit, what is this connection between menopause and our heart health?
So cardiovascular disease remains the leading cause of death for women, and most cardiovascular disease in women actually starts in the postmenopausal period of life.
Interesting. Okay. All right. That is definitely interesting. So does the age that a woman goes through menopause, does that, affect the risk at all?
Absolutely. So the average age of menopause is about age 51. However, we consider early menopause to be anything between 40 and 44, and premature menopause is anything before age 40. And when women go through menopause in that early menopause period, they have about a 3% increase in cardiovascular disease, whereas in that even earlier, the premature period before age 40, that's about a 7% increase in cardiovascular disease risk.
Okay, and so what changes happen to the body, that is impacting the heart during menopause?
There are a large number of changes that happen to the body during menopause. So things like changes in our body composition. So we tend to lose lean muscle mass and gain abdominal adiposity, so more fat around the visceral organs, which are kind of your internal organs, around your heart, your liver, all of those things, and that increases your risk of cardiovascular disease. You'll also see some changes in lipid metabolism, so increases in LDL cholesterol and apolipoprotein B, which is one of our atherosclerotic lipid particles. You'll see some increases in blood pressure, as well as decreases in insulin sensitivity, so there's a higher risk of diabetes. So there's actually a large number of changes in our bodies that affect our health.
Okay, and that all makes sense, all tied to heart health, even though we may not think about it like that. Any warning signs that women should watch for? That menopause age range is so big, so how do you really know? What should we be looking out for?
So, how do you know if you're going through menopause is a little bit of a question first. So things that you'll typically notice with the menopausal transition is, first off, just changes in your menstrual cycle. We typically have about a 28-day menstrual cycle for most women, give or take a little bit, but you may start to notice that your periods get a little closer together, or they may get a little bit farther apart during that transition. You're officially in menopause once you've gone 1 year without a menstrual cycle. That is the official diagnosis. But in terms of things that we should watch out for our cardiovascular health is getting in with your regular primary care provider to do labs, things like checking your blood sugars, your cholesterol, blood pressure, and then any of those cardiovascular risk signs like chest pain, difficulty breathing when we're exercising, things like that should be evaluated by a physician.
Okay, those labs, they can really tell us things that the human eye can't, right? So it's important to get in for that. Anything that we can do to protect our hearts, before, during, and after menopause?
Generally, the same things that we would recommend for any period of your life would be helpful for menopausal transition as well. So things like getting a good, varied diet rich in fruits, vegetables, whole grains, lean proteins, getting regular physical activity is extremely important as we age, and especially doing some strength training. As I talked earlier, that change in muscle mass does occur more rapidly during the menopausal transition, so getting into the gym, doing some strength training a couple times a week can be really beneficial.
Okay, and when should women talk to their doctors about all of this?
So in general, I recommend that you have an annual all of your preventative screenings, whether it is related to the cardiovascular health or otherwise just your overall health is important. However, during the menopause transition, I would actually encourage you to bring up symptoms of menopause with your primary doctor as well. Things like hot flashes, night sweats, changes in vaginal dryness or sexual health, because those can all be signs that we're starting to either go through this transition or have maybe already made it there, but they really do increase your risk of cardiovascular disease as well. So interestingly enough, women who have more what we call vasomotor symptoms, which are the hot flashes and the night sweats, actually have higher risks of cardiovascular disease as well. So those symptoms are not just a nuisance, they're actually a sign of increasing cardiovascular risk, and they can be treated. There are different medication options out there, both hormonal and non-hormonal, in order to manage your symptoms.
Okay, great to know. Some relief is there. Well, thank you very much for being with us this morning, Dr. Werner.
Absolutely. Thank you so much for having me.